There are so many claims online, and from people who may not have the expertise. Everybody seems to have an equal voice online, on the internet, on social media. You don't know their background necessarily, you don't know their education. I'm going to give you some advice as to how to figure out who to believe, who to not believe. First, you want to consider bias, financial conflict of interest. Does this person accept money from outside sources, and which sources? Did they disclose that? Second, you want to consider your own halo bias around the speaker. That's when an individual with some clout might make a claim about something that they're actually not an expert in, but you consider them and their advice to be a little bit superior to other advice because of who they are. Third, you want to research their claim and see, is it shown in an animal study or are there human studies? To find the data, you can either go to examine.com or go to PubMed. And I would go to a third-party source and not just look at that person's website. Fourth, when looking at a trial, you want to ask yourself, is it a randomized controlled trial, or they actually randomized two groups and then compared those groups and tried to eliminate as much bias as possible? Or was it a prospective trial where they found and identified people who had been exposed to particular medication? They just tracked them over time and looked at their results. Who was included in the study? You want to make sure that the people who were included have similar characteristics to you. How many subjects were in the study? Was it a large study, generally more than 100 people? What was the outcome measure? What were they actually studying? What were they given? How often was that being tracked? And then what is the effect size of that measure? You can either look at the p-value, and generally accepted p-values of significance are less than 0.05, or you can look at the confidence interval. The 95% confidence interval should not cross 1.0. If that happens, then it's not statistically significant. If it doesn't happen, then there's a good chance that the original hypothesis is true.